Hello, and welcome to today's webinar, Advancing Medicare and Medicaid Integration, a new era in supporting state efforts to improve care for dual-eligible individuals, which is made possible by Arnold Ventures. My name is Molly Knowles, and I'm a Senior Program Officer at the Center for Healthcare Strategies. I'd like to thank Arnold Ventures for their support of the Advancing Medicare and Medicaid Integration Initiative, which is a funding opportunity designed to support states in making meaningful transformations in care delivery for their dual eligible populations. Next slide, please. So before we get started, I'd like to go over a few logistics. To eliminate background noise, participants have been muted during today's event. There will be a moderated question and answer session with the audience following today's panel discussion. So you may submit a question online anytime by clicking the Q&A icon located at the bottom of your screen. Instructions are shown on the screen at this time. Also, this webinar will be recorded and the slides and recording will be shared publicly on the Advancing Medicare and Medicaid Integration Initiative's website at www.medicare-medicaid.org. Also, at the close of this webinar, we ask that you please complete a brief online evaluation that will pop up on your screen. Your feedback is very important to us, and we hope that you will take a moment to do this. Next slide, please. I'm joined today by three of my colleagues. Ariel Mir, who is Vice President of Healthcare from Arnold Ventures, Kelly Emmons, the Integration Manager at Washington State's Department of Social and Health Services, and Andrew Bean, the Medicare and Medicaid Coordination Manager from the Indiana Family and Social Services Administration. Next slide, please. So for today's discussion, Ariel will first provide an overview of the Advancing Medicare and Medicaid Integration Initiative. Then we'll hear from Kelly and Andrew, who will each provide an overview of their state's efforts to advance Medicare-Medicaid integration for dually eligible individuals. I will then moderate a panel discussion with Kelly and Andrew to learn more about how the initiative funding supports their efforts to pursue meaningful improvements in integration. And finally, we'll close with any questions you may all have. And with that, I will turn things over to Ariel. Next slide.
Thank you so much, Molly. You can move to the next slide. And thank you all for joining us today. I'm so excited to be here with the CHCS team and to have Andrew and Kelly to talk with us about their leadership in improving care for the low-income older adults and people with disabilities in their states and what supports they're using to do so. Before we turn to them, I wanted to take a few moments to explain why, as a philanthropy, Arnold Ventures is engaged in this way, why this is such a critical time for states to focus here, and why we as a funder have created the Advancing Medicare and Medicaid Integration Initiative with our partners at CHCS. Right, so many of you know this information that's on the slide. Right, nationwide, you have over 12 million people who are eligible for both Medicare and Medicaid. And many of these individuals have complex needs. They represent both older and younger Medicare beneficiaries with a variety of conditions that shape their healthcare needs and their lives. But what connects them, even if it doesn't define them, is the co-occurring enrollment in Medicare and Medicaid. Right? They are two different programs run by two different levels of government, different benefits, different processes, different incentives, and all of that together can leave individuals in the lurch. Medicare and Medicaid were not designed to work together, but they do coexist. And as a result, this population often receives fragmented, uncoordinated care that leads to avoidable costs and poor outcomes. Better integrating Medicare and Medicaid is a powerful way to address the fragmented service delivery across the two programs. When we use the term integrated care, we are describing systems in which Medicare and Medicaid programs, administrative requirements, financing, benefits, and/or care delivery, ideally all of them, are aligned. Integrated care models, when done right, are integrated at multiple levels: the financing, the administration, and as well as the clinical and social care delivery. Next slide, please. So why integrate Medicare and Medicaid now? We know that better integrating these two programs can improve the experience of care for dual eligible individuals and quality of care. But why now? First, the number of individuals with complex needs continues to grow. And as that happens, the cost of their care, borne both by the federal government and the states, will continue to rise, putting increasing budget pressure. Second, we've seen only recently the pandemic's impact on dual eligible individuals. They are about 2.5 times more likely to be diagnosed or hospitalized than individuals with Medicare only. And for this population, lack of access to care, fragmented service delivery, and lack of communication and coordination between the two programs can be deadly. At the same time, these last 2 years has really highlighted the need for community-based care. Recent federal investments through ARPA and new opportunities are promoting alternatives to institutional care, but these efforts will be more effective if implemented within integrated models. Integrated care also provides an opportunity to focus on health equity and to center the needs of communities of color and other marginalized groups. Black and Latino individuals are disproportionately represented in the dual eligible population, and they enroll at Medicare and Medicare Advantage plans at a higher rate. Integrated models, if well designed, may be a pathway to address their needs and advance health equity. And finally, we have a policy moment. We're seeing rules from the federal government that offer new flexibilities for states to require greater levels of integration from the DSNPs. We're seeing a wind down of the federal state demonstration program, prompting an opportunity for more states to set up permanent integrated programs. And we're even seeing federal legislation that would require all states to plan for their dual eligible population's needs. Next slide, please. So Arnold Ventures, the philanthropy I work for, is dedicated to improving systems of care that low-income older adults and people with disabilities, in which low-income older adults and people with disabilities receive care. What drives us is a vision of a care infrastructure that prioritizes the whole person with quality, affordable care delivery, while prioritizing an individual's goals, home environment, and community resources. 3.5 years ago, we launched our complex care portfolio to support research, technical assistance, and policy solutions to improve the delivery systems that serve this population. We focus much of our work on Medicare and Medicaid integration and the ways that we can support states' efforts and capacity to adopt integrated models. Next slide, please. But as many of you well know, states continue to face barriers to do this work. We often hear about budget constraints, challenges with access to data, and frankly, insufficient Medicare expertise as key hurdles to states' efforts. That's why we have partnered with the Center for Healthcare Strategies and Molly and her colleagues on the Advancing Medicare and Medicaid Integration initiative, which supports states who are ready to move towards meaningful improvements in Medicare and Medicaid integration, with a focus on the 3 objectives that we've outlined here. Right? Greater integration in the programs for dual eligibles, greater enrollment in integrative coverage options, and a more efficient, effective, and person-centered service mix that leads to better patient experiences, higher quality care, and reduced healthcare costs. Next slide, please. So let me take a moment to provide a little more context on the initiative. So the Advancing Medicare and Medicaid Integration Initiative is a mouthful. AMMI is it's targeted towards states and state Medicaid agencies, as well as state disability and aging agencies involved in coverage and service delivery for people who are dual eligible. State technical assistance partners are a key part of the puzzle here. They may partner with a state to participate in the application process as long as there's formal state approval and participation. In terms of funding, the amount awarded to individual projects is based on the project's size and scope and the ambition of their change. And as for timing, the applications are being accepted now. Projects are reviewed and awarded on a rolling basis. And while the duration of the project can vary, projects should not exceed 30 months. Next slide, please. So what could these projects look like? States and their partners, when they propose projects, can either make a single large-scale shift in care delivery or several smaller scale changes in policies that together represent significant advancement in the degree of integration achieved and that can be sustained long-term. At this point, we've funded several states and their partners, including Indiana and Washington, who you'll hear from today. And you can review their project profiles on the AMMI initiative website. Their efforts include some of the following activities. They are updating enrollment systems and contracting policies to help build out fully integrated dual eligible special needs plans. They're analyzing data for program evaluation and stratifying data by race and ethnicity to address health disparities that exist in the states. And importantly, they're conducting outreach and education with consumers, with providers, and with community-based organizations so that these individuals and institutions know about integrated models, know about the resources that are available, and can choose them if they want. Next slide, please. So the application process moves in several stages. The first step is submitting a letter of interest, providing key information on the proposed project. And there's a form available on the AMMI website, which provides a set of questions to help guide you. But even with our handy form, I know this can be daunting. There's limited time, resources, and frankly, as a staff person, you may not know that much about this space. So do not fear. Molly and her colleagues at CHCS are available to provide assistance and support at all stages of the application process. And this support comes at no cost to the applicants. We really do want to make sure that state applicants have access to all the support needed to design and implement a project that has achievable outcomes to meaningfully improve the state's delivery system of care for dual eligible individuals. In the second step, Arnold Ventures and CHCS will review the letters of interest on a rolling basis. After the letter of interest is submitted and reviewed, a representative from Arnold Ventures or CHCS will reach out to the listed point of contact and follow up with questions and next steps. In step 3, applications whose LOIs, whose letters are reviewed favorably, are then invited to develop a full proposal, which is then reviewed by the Arnold Ventures board, which meets about 4 times each year. So I know I just shared a lot of information about the initiative and the process. All of this is available on the initiative's website, Medicare/Medicaid.org. Also feel free to send any questions to Medicare-Medicaid@chcs.org. So with that, I will pass things over to Kelly Emmons and Andrew Bean to highlight their state projects funded through this initiative.
Good afternoon or good morning, wherever you're at. I want to thank Arnold Ventures and CHCS for the opportunity to talk about the work Washington is doing to support dual eligible individuals. In preparation for our panel discussion, I'm going to cover where our journey started, our current state, and then look at how our grant work through Advancing Medicare and Medicaid will take us into the future. Next slide, please. So our integration story is really framed by our landscape in Washington and also our providers and stakeholder input. So I'm going to start there. And I'm going to start in 2011 when we started planning for our initial dual strategy. Our landscape in Washington was primarily fee-for-service, both for Medicare and Medicaid. And that landscape plays a large role in both the options available to a state and how you can leverage available tools and resources or build on an existing system. We all know there's a number of realities that drive integration, and we recognize that in Washington, just like other states, but change often takes an upfront investment and Medicare knowledge, and we lacked both of those in our state. But again, in 2011, we were selected to receive $1 million in funding from CMS's state demonstrations to integrate care for dual eligible individuals. And we used that money to hire staff and to stakeholder a model. Without this initial infusion of funding, we would not have been able to develop a strategy or have the tools necessary to create a strategy that stood the test of time. I'll walk quickly through 2013 to 2015 because of the model we put forth. We received enhanced match, and then with our model in 2016, we were able to receive shared savings. Shared savings was a big benefit to us and allowed us to invest back in our program. And to this date, with our Health Homes demonstration, we've received $98.7 million. The two key points there are the upfront investment and shared savings that could be reinvested into the program are what sustained us and made it a success in our state that continued to garner legislative and leadership support. Then in 2020, probably before, but that's when we started to notice a shift in enrollment to Medicare managed care. And that was about the same time that CMS released their new rules and really made us evaluate our strategy in Washington. Next slide, please. So I'm going to shift to our current landscape. So based on our current landscape, we needed to broaden our dual strategy and think about what a broader dual strategy would look like alongside our fee-for-service duals model. Now we have an integrated managed care program serving our medical and behavioral health benefits, and our long-term care system continues to be in the fee-for-service delivery system. The Medicare landscape has shifted as well. And we now have 6 D-SNP plans, which also allows us some options available. I will also note we do not have an integration office, nor do we have dedicated staff outside of our Health Home Duals demo. Next slide, please. So as I said, our landscape has shifted. And this slide really shows you the growth from when we started our first dual strategy to where we were at in 2022, when we started looking at new opportunities for a dual strategy that we could best leverage resources to align with our current landscape. So we started to recognize these trends and consider what a more robust integrated strategy would look like for Medicare managed care when the AMMI funding opportunity became available. This again created an opportunity for Washington to leverage upfront investment to move us forward. So next slide, please. So going back to stakeholder feedback, we really looked at what folks said in our initial duals demo and when we were creating our initial strategy. And we used that initial feedback to develop our guiding principles and inform our grant objectives. Those guiding principles have really helped us stay true to our initial strategy while also building and changing with the way that our landscape looks today. Next slide, please. So with those guiding principles in mind, we looked at our current work and where we wanted to get to and identified 3 main objectives that we could achieve during our grant period to drive integration forward in our state. And that also aligned with this funding opportunity. These are really building blocks that get us to a more informed state where we can continue to make informed decisions and leverage resources to continue to enhance integration efforts in Washington. Next slide, please. Okay, so this is about where we are going. The funding through Arnold Ventures and the support for creation of the grant application really helped to align us internally around our goals. We had a lot of good work happening, but we needed to organize and have resources dedicated to it. And through each of our objectives and plans for the future, we've woven health equity into our framework. And by the end of our grant period in September 2024, we plan to have a transformed system that won't be at its final place, but will be well down the path to achieving better outcomes for Washington duals. So thank you very much for allowing me to share this, and I'll pass it over to Andrew.
Thank you, Kelly. Really, I'm always amazed at when you talk about what you're doing in Washington with this project. It's really awesome. Really cool stuff. I would like to also thank Arnold Ventures and CHCS for having me speak and for supporting all of these initiatives. It's been such a help for us as a state who has kind of started from a slightly different posture than Washington to really help build our capacity to drive some of this change and to really think meaningfully and progressively about kind of integration and alignment strategy in our state. So I think, as I said, I think Indiana is coming from a little bit different of a posture from Washington, but I think you'll notice a lot of similarities between how Kelly and I have kind of approached this, and some similarities that I think are very relevant in terms of like how states can actually approach this project for themselves and actually kind of get a good kind of thread into potentially participating. Next slide, please. So when we looked at our landscape, this is kind of what we saw. We both looked at kind of what we were doing, both programmatically, but also kind of what was happening in our state in terms of LTSS reform. And we looked at particularly at Hoosiers over 65, aging Hoosiers, and looking at what was their experience of care with long-term services and supports. And so what we found was that Hoosiers want to have choice in their systems. They prefer to age at home, and they don't want to necessarily be in an institution when they grow old. Also, cost is a big driver for developing long-term sustainability in your system. Indiana has about 2% of the U.S. population, but 3% of the nursing facilities, so that's a pretty disproportionate kind of balance for us. We, as Ariel mentioned earlier, I mean, duals take up a very small proportion of enrollment, but are a high percentage of the spend. So you can see LTSS members are about 4% of Medicaid enrollment, but take up about 28% of the spend, and that's a pretty much prevalent, mostly duals. And then also Hoosiers want to have quality, and currently Indiana system is a little bit behind. AARP's LTSS scorecard ranked us 44th in the nation. That was an improvement from 49th in the previous scorecard. So we're happy that we're moving up, but there's a lot of work to be done, and a lot of other things that we need to be focused on. Next slide, please. And so and that kind of brings me to the Medicaid and Medicare coordination kind of status in Indiana. We looked across our system and we said, hey, we have some issues with our long-term service and support system that encompasses a lot of dual eligibles. And so really looking at our population and saying, well, where are we at in terms of Medicare and Medicaid coordination? And I'm not going to go through all of these, but as you can see, we weren't really in a great space with our Medicare and Medicaid coordination in Indiana. We have about 230,000 dual eligible members. As Ariel mentioned, most of ours experience a high level of care fragmentation. We are kind of at that space right now, and so we only recently just began to place a much higher kind of premium on integration and alignment, and so that has helped us to, I think, start to look across our system and say, okay, well, how do we apply this to things that are relevant to our state? Next slide, please. And so we've really focused on building our DSNP infrastructure in the state. So when you look across, and I love this slide, I love presenting this slide always. We started out in 2015 with about 1% of our dual eligible population enrolled in a DSNP, and our DSNP's in about 14 counties in the state. And we moved to 2021, we had about 28% of our dual eligibles enrolled in a DSNP, with pretty much all counties being served by a DSNP. So this really shows, as kind of Kelly mentioned in her slides, I mean, there's exponential growth going on in the Medicare Advantage space and the DSNP space across the US and everything. And so this is really indicative of more national trends, but we've really tried to build a pretty robust DSNP infrastructure in our state. Next slide. And so that means, you know, when we look across that, and then when we look at the population and what we could potentially be doing, we really looked at the kind of opportunity for integration and everything. And so these numbers are actually beyond what you saw on the previous slide, and we've grown even more into DSNP enrollment, with 40% of our dual eligible population being enrolled in DSNPs. None of our dual eligibles are currently enrolled in managed care Medicaid, though. And so there's a lot of opportunity for integration if we were to move to kind of a more aligned system. Next slide, please. And so that's kind of where our future state kind of comes in. So when you look at Indiana's current state, we kind of have our duals in fee-for-service Medicaid. They have either fee-for-service traditional Medicare or Medicare Advantage. And so you have this very fragmented system that doesn't coordinate well. And we want to move to a future state that really kind of brings everything together, really focuses on comprehensive care coordination. And as part of that, the coordination between Medicaid and Medicare, if you can have the same companies deliver both that Medicaid managed care as well as the managed Medicare as well. Next slide, please. And so that brings me to our activities and our objectives in our project. So our first objective was to design a Medicare Medicaid integration strategy for dual eligible individuals enrolled in the state's planned Medicaid managed long-term services and supports program. Some key activities of that were developing a comprehensive LTSS reform plan that incorporates system design elements and supports the increased integration of Medicaid and Medicare, and supporting provider rate strategy development that focuses on quality, outcomes, and sustainability. Next slide, please. And the second objective was to engage providers in a program development process, provide continued educational support around program design, and acclimate them to MLTSS plan networks. Some key activities were providing stakeholder education activities and capacity building for providers of home and community-based services, supporting business acumen training for LTSS providers, and facilitating discussion between managed care entities and community-based organizations for smoother transitions to MLTSS. So what you can see in our project and in our key activities, we really went from this kind of initial assessment of our landscape, then assessed what our needs were, and then we built the program to really build on what we saw from our perspective. And I think Kelly kind of articulated from her perspective, which is a little bit different, kind of coming at it the same way. So I want to just emphasize that regardless of where your system's at, this is something that can be done.
Great. Thanks so much, Kelly and Andrew, with providing an overview of your state efforts to advance Medicare and Medicaid integration. So now we'd like to hear more about your experiences with considering the funding opportunity and then how it supported your state goals to advance integration. So to start with a broader context for your state, what does meaningful integration look like within your state landscape? And why did you consider the Advancing Medicare and Medicaid Integration funding opportunity as a way to support your state goals to advance integration? Kelly, we could maybe start with you and then turn to Andrew.
Yeah, thank you, Molly. So I think meaningful integration, changes, right? I think one of the things that was really important to us in our initial dual strategy and going into the work that we are undertaking now is really listening to stakeholder feedback and really looking at where we've been, using lessons learned, and then applying those things that are working into your strategy going forward. I think one thing that's really true with our dual strategy was that intentional care coordination at the service delivery level is important. And even in a financially integrated system, and I think Ariel said this well earlier, is that intentional care coordination is what makes a difference in beneficiaries' lives. And so in the work that we're doing right now, we're really leveraging the lessons we've learned from our health home schools demo and the type of work that was done with high-risk populations there in the fee-for-service system, and trying to apply that into our strategy going forward, as we leverage some of the new tools that are available to us as well under Medicare managed care.
Yeah, I think I mean, I would echo kind of how Kelly has talked about this a lot. And I think we put a lot of focus on care coordination as well. I think that we really see that as a linchpin to our work, and really kind of driving some of the integration. I think where I would start in terms of how, what does meaningful integration look like? I think meaningful integration looks like, from Indiana's perspective, I think movement in the right direction, and continuously iterating and building off of the progress that you've made in prior years and prior months. We're moving to a managed long-term services and support system, which is great. And I think we have this we have our eye on the ball in terms of that's where we want to end up. And so we know where the goal is, but we also have had about 2 or 3 years where we could actually start building, I think, stepwise towards that goal. And so we actually, when I think of integration, I think of it in terms of building kind of very methodically, step by step, to achieve a goal at the end that's sustainable. And so integration, it can be a very small, it can be smaller steps. It doesn't have to be the big programmatic change or the big programmatic device at the end of the rainbow. It can be, those small steps that really improve care coordination, building stakeholder engagement, so that you actually are practicing meaningful care coordination. I think that's what, in my mind, what's important to remember.
Great, thanks so much. It's really helpful. So now digging more into the specifics of your AMMI project development, how did the design of your project goals and activities evolve throughout this proposal development and application process? And also, do you have any suggestions for states to help prioritize their goals and determine what activities could be accomplished within the project period? So we'll switch and first turn to Andrew to start, and then have Kelly follow.
So I think we were lucky in terms of having, that we knew where we were going kind of programmatically. We knew we wanted to go to a managed long-term services and support system that supported really aligned and integrated Medicare and Medicaid provision through, companion DSNPs. I think what we kind of didn't really understand was the how much kind of went into that space. And so I think the design of our project goals kind of evolved as we kind of really sat down and thought, okay, well, how, what's going to be most important? It's going to support us in this space. I think you can get really overwhelmed and really lost sometimes with what can be available and how you can potentially get support. And so we started off with a little bit more. I think we started off with a pretty broad kind of set of things. I think we had some data aspects in there, and it ultimately ended up kind of getting whittled down to some really, I think, basic things. But I think the basic things actually are the more important stuff. So we ended up getting some TA that really supported kind of building this integration vision within the system that we're looking at. And then also kind of the provider aspect of this too, I think is really, really, really critical. And so I think as we move forward, that was kind of how it evolved towards the goal.
Yeah, I think I'll kind of second Andrew, and I'll highlight that, we were doing good work in our state, but we didn't have a plan. And the process of actually writing the proposal and going down this path was what catalyzed us to really think about what could we achieve in the next, amount of time. How does what we're doing align towards a common goal? And I think what I would say is our goals did evolve through the process of writing this proposal and of really needing to get down to what are our objectives. So I think the thing I would say, and I think Andrew said it too, is I don't know that you have to have a fully baked plan going into this. You can have ideas and thoughts about where you're trying to get, and the process itself may be the thing that helps you get to your objectives and get to your goals.
Great. Thanks for all those considerations. And so digging into those processes, what internal state processes did you need to navigate to receive approval to seek grant funding and then also access the money? And would you offer any advice to other states in regards to these processes? Kelly?
Yeah. So I think for us, one of the key things was making sure that we got leadership buy-in, right? You really need your leadership to understand where you're trying to get to buy into this idea of integration. And not only do you need leadership buy-in, but you need a champion. You need a champion for this work internally, whether that be somebody who's kind of driving, or that's somebody in leadership that really believes in the path that you're going down. So I think those are two key things. I think there's process elements to, gaining funding, but I think the big key things for me is the leadership buy-in and a champion. And then I think the third thing I will just quickly say is setting goals that align with your state's larger vision, I think, are a way to create a picture of duals integration that doesn't feel like this different thing that's happening. So I'll pause there.
I 100% agree with Kelly, and I'll probably say that again in another question. But I think kind of going with that, something that's really important is, aligning with state vision is absolutely 100% correct. Getting buy-in and getting some policy entrepreneurs who are willing to push this in a very energetic way. I think what that boils down to in my mind is really being able to also articulate what you're doing and why it's important, and not, something that I've always struggled with is when you use integration, people kind of just it's a blank. They don't know what it means, and we're always caught trying to define it for people, so it's a little bit more simplified. And so I think what we had to do and what we had to learn to do was really talk to our internal folks. I know we had to talk to a couple of our internal agencies with the state to articulate why we were doing this, what this was, how it benefited kind of the agency and everything, and so really honing in on how you communicate about this and how you talk about it, along with all the other things that Kelly had mentioned too, I think is really important.
Great, thank you so much. And I think, as you were developing your projects and thinking through the project activities, it'd be helpful to hear how you approached and work with technical assistant partners, consultants, or other vendors to support your project work. Andrew? Yeah.
So I think we have utilized technical assistance partners from the very beginning of our work. And this goes way before even the Arnold Ventures grant to help assist in terms of just building our capacity and being able to actually meaningfully talk about this in a way that it can actually resonate with people. I think when we're talking about the Arnold Ventures grant, that was something that we made sure we kind of incorporated in, and was really it is the biggest component of our grant, which is working with a technical assistance partner to kind of weave those integration and alignment ideas into the fabric of this project, and then also providing that kind of support to executive staff, like as Kelly mentioned, and frontline folks too, to make sure that you're explaining that vision in a way that people understand and can actually get behind, because if they can't do that, then you're kind of sunk.
Yeah, and I don't have a lot to add. I think where I will focus is the technical assistance that CHCS provided as part of the development of our proposal. So in Washington, we're not really using technical assistance partners for our project per se, but we did use the expertise at CHCS in the development of our proposal and helping us develop a story, develop a holistic vision of where we're trying to get to, and kind of put the pieces in place. And I think for us, that was extremely beneficial. Both when we're trying to have the conversations with leadership and in presenting our proposal to Arnold Ventures. So I don't have anything else to add. I agree with Andrew, but I think that I'll stop there.
Great. Thanks so much, Kelly, for that. And finally, I think, you've touched on, both have touched on this, but really, what would you say to states who, are interested and want to pursue integration, but may be apprehensive about starting, like where to start this whole process? And I'll turn to you, Kelly, first.
Yeah. So what I would say is the language is daunting, right? It feels really big when you talk about integration, and there's all this language floating around out there, and there's all these things that you could do. What I would say is just start from where you're at. I think a really meaningful activity would be just to evaluate your landscape. Look at where there are opportunities for improvement. They don't have to be big. Even small changes can make a huge difference in the experience of a beneficiary. And I would say lean on your technical assistance partners to help you if there's something you want to do, but you're not sure you have the right language or you don't know the right policy lever. Just get the conversation started. And I guess that would be my advice. You don't have to have a big vision to make improvements in your system.
I think Kelly said that perfectly. I think coming from a state that really didn't have a vision, maybe 3 years ago, we started very small, and we kind of built out from a CMS requirement in 2020, and kind of built on that foundationally and built up from there. I think what Kelly said about words is very important. So like we hear all these policy devices that are thrown out there, like FIDE SNPs, HIDE SNPs, and financial alignment initiatives, and it gets very intimidating, and it gets very, very daunting, and very kind of just gray really quickly. And I would say take a step back if that daunts you, and you can take a step back and just say, what can we do? What's a step we can take? I think that's how we have kind of approached things from multiple years kind of doing this, where we're like, how do we build on what we already did, and how do we do it in the right way so that it's sustainable? Whatever you do, I think make sure that you're not setting yourself up for just this kind of like big letdown because you've done something that you've bitten off maybe more than you could chew on the programmatic side. I think it's very, very important to just make sure you're making meaningful progress that you can continue throughout and keep developing on year after year.
Great. Well, thanks so much for a really, helpful, insightful discussion. I think that all of these points that you've made will really be helpful for others. And as states try to think about their own state efforts for advancing integration. I'd like to move to the next slide, please. So we'd like to move to the Q&A portion of our agenda. Just as a reminder, you can please use the Q&A feature at the bottom of your screen to submit any questions you may have for our speakers. And so with that, I will turn to some of the questions that have been submitted during the presentations. So it looks like one of our first questions is more of a process question. So when should interested states engage with CHCS? Should they talk with CHCS before submitting a letter of interest form? Or can they just submit the form and expect to talk with CHCS afterwards? So I can take the lead on responding to this one. So either approach is fine. If a state has a clear idea for a project and wants to write and submit their letter of interest form, they should go ahead and do so. However, if a state has questions or needs help with fleshing out, an idea or talking through project activities, CHCS is here to help. We really want to encourage states and their technical assistant partners to reach out to us as soon and as much as possible. Our goal really is here to help you, to help states, shape their projects in a way that improves their chance of being funded. And as a reminder, CHCS will be reviewing all of the letters of interest to ensure that they include all the required elements for Arnold Ventures to understand and to consider for funding. And in some cases, states and their TA partners may be asked to refine or adjust their ideas slightly before the project concepts are reviewed by Arnold Ventures. Let's see here. So I think the second question I see coming is, I think could be directed to Kelly or Andrew. Where do you think states need to be when thinking about applying for this initiative? Do you think states need to have a certain level of integration in place to consider the opportunity? And I think you've touched on this already, but just helpful to hear you to reiterate any key points from that.
I'll go ahead, Andrew, and then you can, okay. I think that, no, you don't have to have a certain level of integration. I think, we had started our integration journey in 2011 with a different landscape. And we have a really good fee-for-service dual strategy. But we also needed to leverage a new strategy and looking at how the duals are served in your state and building up from there. So from wherever you're starting, you can build up. And the other thing that I would say is that your goal doesn't have to be fully integrated. That is not the goal that Washington has at this point in time. That said, we continue to make significant progress in integrating care for duals. So I think just starting where you're at, and I'll pause there, Andrew.
No, I think I think you said it great, Kelly. I think the one thing I would add is I think you don't need to have any integration background or kind of rooted policy kind of things at your state. But you do need, I think that what Kelly had mentioned before about the enthusiasm and the policy entrepreneurship and people who support that vision. I think that's really important, because otherwise it'll be really difficult to get anything off the ground if you don't have that aspect of this and build that.
Great, that's really helpful. I think this next question would be targeted more towards Ariel. Is this initiative targeted towards states new to integrated care, or can states that have developed integrated care programs apply as well?
That's a great question. And we have two panelists today who represent one of each. When Andrew and his colleagues in Indiana got started, I would have characterized them as kind of new to the integration journey. And Kelly and colleagues in Washington State, we saw as being, leaders and role models in the field. And I think what was common across both was an aspiration to a meaningful improvement in integrated programs, whether it was the establishment of one that didn't exist before, or a significant program change that led to greater access to an integrated program for individuals who chose Medicare Advantage in Washington State. And so while I will say, initially I thought, Washington State, they don't need any help. right. You know, when you look underneath about kind of what it takes to actually deliver on the promise of access to integrated care for every person who's dual eligible in the state and and certainly in the country, there's a lot of work to do. So we take all comers so long as they are committed to a meaningful improvement in their program design.
Great, that's really helpful. It looks like one other question we have more about the application process. A participant writes in, if I use the LOI form, can I still work with CHCS to refine that LOI? And so I'll take the lead. Yes, you know, we have full expectations that we will work with the states and the TA partners to refine the responses that are included in that LOI form. Really, again, our goal is to assist states with developing their projects. And so that could include, you know, helping clarify or refine project goals, objectives, as well as, you know, designing specific project activities that really help advance long-term policies that would support integration for dual eligible individuals. As current grantees can attest, and Ariel has mentioned, the process can be iterative, but we hope that it really helps and adds value to the final project proposal. Let's see here. There's one specific question for Andrew. Just a clarification question, I believe. In Indiana, are your Medicaid medical services still traditional fee-for-service model, and only the LTSS is being managed versus all? Does that include your MLTSS include medical services?
So, I mean, what I would say is everything is still in fee-for-service right now in Indiana, but we're moving towards a comprehensive benefit that would be all inclusive with the medical and the LTSS being included in managed care.
Great, thanks. And then this question is, I think, also for Kelly and Andrew, just to reiterate or focus in on how you decided on your project goals and determining whether they were feasible within the project period. Just to
Kelly, I can jump on that first. And so I mean, I think we needed, I would say we needed help to kind of determine that and to kind of work through that in our minds of what was doable and what was also going to provide the best value for what we're doing. I know as I mentioned before, we had to cut out some things that, I mean, I was really enamored with, you know, when we were writing it. I mean, there was some data stuff that, I mean, I love data and I'm a huge data fan, and we just, it was not necessary, and it was not something that we wanted to include at the end of the day. Would have been really beneficial to include at that time. And so I think it's, you know, talking with folks and really talking it through helps you understand how these kind of considerations happen. It helps you build kind of your own capacity to understand how what you're talking about can really benefit your system. So having those conversations, working through it, I think is really important.
Yeah, I think I'll just add to Andrew in that you might also want to approach the project as like a path towards your end goal, that this is time limited, right? And so you need a sustainability path. And you may not get to your end goal by the project period, but part of the sustainability path and biting off of the right size chunk is figuring out what you as a state can continue to move forward. And that was part of our decision making in Washington, is what are the pieces, what are the critical pieces to move us forward, and what can we sustain over time.
Great, thanks. Have another kind of process question. How long does the process take from start to finish to have an LOI approved, or what is your range in that? And so I think I'll just say from the CHCS perspective, I think it varies. And so Ariel, please chime in too. I think, you know, as Kelly and Andrew have discussed, and every state is different, as everyone knows. And so the process has varied quite a bit from grantee to grantee. And really, I think the consistent thing is that, you know, we meet often and work with CHCS, we meet often with the states and their TA partners to really assist and help you work through those, to refine the project proposals. And so, you know, every state is coming from a different perspective and have different goals. And so those itself will, you know, so it's hard to put a specific number or anything like that because it has varied quite a bit. Ariel, I don't know if you have anything else to add.
That's the first thing they teach you when you start to work on Medicaid, that every state is different. That's all true, Molly. I will say our board, with whom we have to seek approval for all the projects, meets about quarterly with us, and so we have kind of a rolling process. And depending on the state staff's bandwidth and their coordination, if they have a TA partner, sometimes that can speed things up. If they're looking for a TA partner, that can slow things down. And what I would say is the time, which does vary, is usually, you know, to Molly's point, is not a silent time. It's not a kind of, you're waiting to hear from us and you don't know if it's 2 months or 8 months. The time is the kind of, for the iteration of the project, for the refinement of the goals, for getting buy-in from other key partners in the state. And so we are here for you, and the CHCS staff is here for you. And as often as you want to come to the table, I'm ready to talk.
Great, thanks so much, Ariel. I think one maybe final question, we'll see how much time we have left. Just Kelly or Andrew or both, if you could just, one question is around how you are using stakeholder engagement. And I know you've mentioned it a little bit briefly at high level, but you know, kind of talking through that, and do you think that this element is necessary?
Andrew, I'll just take a quick swing at this. Is it necessary? Absolutely. And I think broad stakeholdering, I will say one thing that I'm really excited that we're doing in Washington is stakeholdering with clients or beneficiaries, some of the changes that we're trying to make, some of the ideas that we have, the way that we talk about this work, and then also engaging with our SHIBA representatives, because like we've talked about integration, the language around integration is complicated and confusing. And if we want beneficiaries to understand it, we have to engage with the people that they trust to talk about this. So yeah, I'll just say, I'll stop talking and say stakeholdering is critical.
Absolutely. I totally agree with Kelly on that. I think what I would also say is, you know, stakeholder engagement can work kind of bi-directionally, right? You're doing outward stakeholder engagement with your partners, with provider partners, with outside groups and everything, but you're also doing it internally with other, you know, maybe sister agencies or other government agencies to make sure that you're building kind of this really fundamental understanding of what's going on in your system and everything. And I think that it's incredibly important that you have the conversations with folks early and often. I know that we have, I mean, we've built a kind of a communication pipeline to our state health insurance assistance program, or SHIP organizations, to talk about these kind of integration goals. We've been at it for a year with our area agencies on aging and our dual eligible special needs plans to build kind of those communication strategies. And so when you come at it from, I would also add to Kelly, I mean, stakeholder engagement is important, but sustained and long-term stakeholder engagement is important, because otherwise it's not gonna, I mean, we're just now kind of getting through around the Medicare aspects of things and being able to have like a shared conversation where everyone's now kind of on the same page, and it just takes time.
Great, thanks so much. I think we're almost at time, so if we could advance the next slide, please. So we will post the slides and recording of today's webinar on the initiative's website again, which is www.medicare-medicaid.org. And there you can find more details on the initiative and instructions on how to submit a letter of interest form, as well as sign up for email updates. And if you do have additional questions, you can also send those to our mailbox, which is medicare-medicaid@chcs.org, or you can include them in the webinar evaluation survey that will pop up at the end when you exit. Again, please consider filling out the online evaluation form. It's very important for us to hear your feedback, and we really appreciate your participation. So I'd like to thank you all so much for joining us. I'd like to especially thank Kelly and Andrew for participating, as well as Arnold Ventures for supporting this initiative. Thank you all, and enjoy the rest of your day.